My friend said she was diagnosed with diabetes, and I told her, don't panic. Try to change your diet. Doctors are prescribers of medicine, and not all doctors, some doctors. Doctors were taught to prescribe medicine up to the point where the patient received the highest level of insulin. Doctors constantly tell their patients they will need to continue to take their medications for the rest of their life. That's not true. They do not give a prescription on nutrition. Doctors continue to medicate instead of dedicating their time to learn how the science of nutrition can be very beneficial to patients' health without the dreadful side effects. Many doctors can't seem to get on board with a nutritional lifestyle for their patients. Doctors tell you they want to see you back in 3 to 6 months. And when you return after 3 to 6 months, everything is out of whack. Your blood pressure is up. You have continued on that path of anxiety and depression. Your weight is out of control. You could have eaten your way into health within 3 to 6 months' time. Doctors don't decrease medication. They constantly add medication, and that's what they're taught, just to add on more. There is no exit plan when you choose medication over a healthy diet. The patient has now become the weasel on the weasel wheel. Here are things that you can do to decrease your risk of having heart disease, kidney disease, glaucoma, suffering a stroke, all under this systemic umbrella of diabetes. You can eat foods with fiber and protein. Make sure you get plenty of hydration, water, cranberry juice, grape juice, pomegranate juice. And make sure if you go to the store and get these juices, make sure that they don't have any added sugar. And when you drink them with drink about 10 ounces, cut it half and half of juice and half of water. Sparkling water would be good. And for all you pop drinkers out there, that would really be a special treat for you. Eat foods with vitamin D like salmon, eggs, milk, sardines, mushrooms, oatmeal. Exercise and get plenty of sleep. And try to reduce your smoking. I know that's a hard one to do. It's very hard. But if you can quit altogether, that would really, really be helpful to your health. Limit your use of alcohol and try to manage your stress. This will help fight low-grade inflammation. Eat foods to help protect your kidneys like macadamia nuts, shiitake mushrooms, apples, pineapples, red grapes, garlic, turnips, fatty fish. And if you develop kidney disease, your kidneys no longer work at an optimal level. To reduce the potassium, calcium, and phosphorus, you have to eat foods that don't have such high levels of these three minerals. You must monitor the foods you eat. Build up a potassium. You may feel like your heart having heart palpitations, shortness of breath, chest pains, nausea, or vomiting. And this is very life-threatening. Magnesium. If you're having an increase in magnesium in your body, you might have muscle weakness, fatigue, nausea and vomiting, trouble breathing, cardiac arrest, and you don't want that. The sudden stopping of your heart. And you have foods that are rich in magnesium. Avocado, dark chocolate, spinach, edamame, salmon, sunflower seeds, beans, tofu, whole grains, yogurt, and not the yogurt that have all the sweet and sugary in it. You can just get some plain Greek yogurt and put fresh berries like blueberries, raspberry, blackberries, strawberries, even cherries. That'll be good for a good treat, and it would help you. A calcium deficiency may result from dietary factors, health issues, or medical issues. Calcium deficiency is linked to dental problems, depression, different skin conditions, chronic joint and muscle pains, fractures, seizures, and disabilities. You can eat milk, cheese, yogurt, beans, spinach, nuts, and seeds, including almonds and sesame seeds, figs and broccoli, You have so many choices with nutrition, but a pill is just a pill, and it limits you to your choices, and it can also limit your life. Ask your doctor, are you here to treat my life? Are you here to treat my death? Is the combination of nutrition and medication a better medical plan for the patient? Every patient is different. Some patients can ride that wave of just eating healthy foods, and that's good for them. Some patients may have to use the combination of two, medication and healthy foods. But medication and healthy foods could really help, and some patients have to add on supplement. But whatever route that you take, make sure that the end results come with not adding so much medication, but a subtraction of medication. And in this process, you will want to tell your doctor that if you can decrease the medication, that's your goal. And the ultimate goal is to just get rid of all your medications and to eat a healthy diet. So, is there an exit plan to take away the medication and lean in on a healthy diet and to alleviate the medication and not add more pills? Well, what do you think? Think about it the next time when you see your doctor and tell him what your plans are. So, if you like this video, please come back. I have so much to share. Hit that subscribe button and like, and I'll see you on the next video. So come back.